So remember, when we are reading CT scan or MRI, when we read CT scan, we talk about density, isodense, hypodense, and hyperdense. When we are reading MRI, we talk about intensity, that will be isointense or hypointensity or hyperintensity. So understanding city brain, our lecture first will be on density, isodense, hypodense, and hyperdense. So it's mean that the brain parenchyma, the density of brain parenchyma, we are going to compare it with bone, density of bone, density of calcification, which can be physiological or pathological calcification, blood, which I mean bleed, and also air, fat, and ischemia. The Hounsfield unit, or which can also be called CT number, by which we can say different tissue will get hypodense, hyperdense, or isodense. The more Hounsfield unit, the more dense, white or bright, the less, and that will be hypodense or dark. So like hypodensity and tissue with Hounsfield unit. Air is having minus 1000 Hounsfield units, so it is the most hypodense. Then fats with minus 100, water with 0, and CSF with plus 10, and ischemia is also hypodense. Now hyperdense tissue with Hounsfield unit, that is bone, plus 1000, it is the most hyperdense. Then we are having calcium calcification, that is 200 to 1000. Then we have blood bleed, that is 55 to 80. Then the contrast metallic foreign body also looked hyperdense on CT brain. Bone is more hyperdense than calcification. Calcification is more hyperdense than bleed. The calcification may be physiological or pathological. The pathological calcification are calcification of pineal gland, calcification of basal ganglia, calcification of choroid plexus, and dura mater. Pathological calcification, meningioma, and aneurysm. In this diagram, you can see ear is more hypodense, then bone is more hyperdense, then you see the brain, and then CSF. CSF is hypodense. Hypodense mean black, and hyperdense mean bright or white. Now in this CT scan, at the right side you see there is hypodensity, so it's mean there is infarction on the right side of the brain, MCA territory. Now you see there is hyperdensity, I mean bright or white on the right side of the brain, MCA territory, so this is bleed. So before I said that calcification is also look bright or white on CT scan. So pineal gland calcification, basal ganglia, and choroid plexus and dura. Any metallic foreign body like stunt and coil, they will also look bright on CT scan like this. Now here you can see there is hyperdensity on the left side, so it is bleed. See the area which I marked with a black circle is hyperdense area. It is blunt out meningioma. So meningioma also look hyperdense on CT scan.